Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn some important points about aripiprazole. So aripiprazole is actually D2 receptor partial agonist. It is D2 receptor partial agonist and it has affinity for D2 receptors. It has affinity for D2 receptors only less slightly than dopamine. It has affinity for D2 receptors but little less slightly than dopamine. But this has a unique action. That is, it increases dopaminergic activity when dopamine concentrations are high. If dopamine concentrations are high, then it increases the dopaminergic activity. Like for example, in mesolimbic tract, the mesolimbic cortex, the dopamine activity will be high. So in these places, it increases the dopaminergic activity. Whereas if you see in prefrontal cortex, where dopamine activity is low, if dopamine levels are limited, it decreases. First it decreases. If dopamine concentrations are high, it decreases the dopamine activity. If dopamine concentrations are limited, then it will increase the D2 or activate the D2 receptors. That is the reason why it is used in schizophrenia. Okay, so this is about aripiprazole. Thank you for watching.
Thank you and thank you for watching.